You give your child medications and a few minutes later they throw it up. What do? Do you give more medication? Dr. Daria here, board certified ER doctor, and I'm a mom of 3. And this happens all the time, and there's not a lot of science on it. In fact, there was this one study, but they just kind of asked a bunch of nurses and doctors what they did, and there was a lot of variability. So this is what I tell my patients. Number one most important factor is time. If it's been 15 to 20 minutes since they took the med and they vomited, typically pretty safe to just go ahead and redose it. On the flip side, if it's been over 60 minutes, then you don't need to redose it. So that's helpful for those groups of people. But what about those in the gray zone, say like 30 to 60 minutes? What do? 3 factors to look at. One is type. If it's a medication where they don't get harm from taking just a second dose, or where missing a dose might delay healing, like say an antibiotic, I'll typically err on the side of redosing. Versus a medication that can have toxicity, such as acetaminophen, you may be just a little more cautious. Number 2 is look in the vomit. Yeah, you get to, because you're a parent and that's a job. Was there a pill in there or a lot of the liquid? That'll help you know how much your child got in. And number 3, if you're still not sure, is there an alternative? So you gave them acetaminophen, can you give them ibuprofen now instead, or vice versa? If you are still not sure, that's when I typically need to see a patient or talk to their parents to give them personalized guidance. It's a great time to call your pediatrician and ask them what to do. Comment guide and I'll send you my medication dosing log to help you keep all these meds straight.